So I always make it a habit to go up and look, because sometimes you can develop a lot of abscesses in the submandibular gland. Okay, so I always just make it a habit to go up and look. Guys, the more mistakes you make, the more likely you're going to be covering everything, right? You make a mistake, you know, almost an ultrasound, you never make that mistake twice. Once you miss something, because it's going to happen, guys. Nobody's perfect. You're going to miss something every time. That's how you learn them. That's why I say make the mistakes right now. Get your hands on the transducer while you're in school, because make all your mistakes as a student, so you're not, making mistakes on patients. That was my biggest disadvantage, is that I was only in school for 1 year. And imagine, like, you guys are coming up on the year, right? And imagine going out to be a technologist right now. I'm sure you guys don't have the most confidence in yourself, right? But I'm scanning real patients. No telling how many mistakes I made on these patients. And it's costing somebody, probably some kind of, it could be some serious issue, right? So definitely get your hands on this transducer and make those mistakes right now. Okay, so this is a normal variant here, right, guys? The pyramidal lobe, and when it's present, it's not always present, but it's present in about 50% of the patients. It is a lobe that arises from the isthmus and extends superiorly, just anterior to the thyroid cartilage. Here you can see it right here, kind of looks like a little finger-like projection right there. That it would be called the pyramidal lobe. And it's you will see it in about 50% of patients. But that's just a normal variant. That's just like a Frisian cat. That doesn't mean it's pathology. Right? So the thyroid gland is made up of 2 cells. All right? Guys, I kind of organize it a little different. If you're following in the book, it's probably not going to be exactly like that. I tried to organize it in a way we can easily understand. I try to hit everything twice, so I'm going to cover this right now, but I'm also going to come back and cover this again. Okay? So it's made up of 2 cells, guys, follicular and parafollicular. Okay? The follicular makes up the majority of the thyroid tissue, and it secretes the hormones triiodothyronine and thyroxine. Triiodothyronine is T3 and thyroxine is T4. One way I can remember this, guys, which one is T3 and T4, so you don't get them confused, is I remember T3 has 3 I's in the word. That's how I remember that. T3 has 3 I's in the word.
Or the word try. Try stands for 2.
That's true. That's true. That's true. Or try. Okay? And thyroxine. So those make up the follicular cells of the thyroid, which makes up majority of the thyroid cells. All right. The follicular cells, they require an adequate supply of iodine to produce those hormones. Okay, to produce that T3 and T4 hormones. Okay, the thyroid is one of the only glands that can absorb iodine. Okay. So the other type of cell in the thyroid would be the parafollicular cells, also known as the C cells, because they secrete calcitonin, which is the other thyroid hormone. Remember I was telling you there's 3 thyroid hormones, T3, T4, and calcitonin. Those are 3 thyroid hormones they're going to secrete. I'm going to go in detail about them later. But our 2 types of cells within the thyroid are follicular and parafollicular. All right. So let's talk about the size of the thyroid. So again, I use all the numbers according to this text. If you read other texts, they can kind of vary, but they shouldn't be off by that much. So the size of the thyroid is between, in an adult person, is 15 to 20 grams in an adult person. And it varies with gender, age, and body surface area, okay? So if you're a bigger person, you probably have a bigger thyroid, okay? And it tends to get smaller as you age. And it's slightly larger in females as well than when compared to a male. I don't know why, it seems like there's a lot of, you guys are gonna learn, there's a lot of pathologies that affect women more than men, but men die sooner. It's crazy. The lobes, when you're tall, the lobes often appear elongated in tall individuals and more oval in short individuals. Okay? Each lobe is about 40 to 60 millimeters in length, how long is that when it, and, cause you know we measure in centimeters. How many centimeters is that?
0.4 to 0.6.
Or 4 to 6 centimeters, right?
Mhm.
4 to 6 centimeters, right? Right?
Point.
0.4?
No, from centimeters.
No, yes,
From
4 to 6,
millimeters
4 to 6.
centimeters, it's gonna be 4
4 to 6,
centimeters.
yeah.
4 to 6 centimeters. Okay? 4 to 6. I'm just making sure y'all up on y'all scales there. Okay? So each lobe is about 40 to 60 millimeters in length, 13 to 18 millimeters in AP diameter. AP diameter, that would be our height measurement in long. You know how we measure the long of the kidney, and then we measure the height of it? That's what they're talking about with AP diameter, anterior to posterior. Okay? And this is in your book, but it's about 15 to 20 millimeters in width. Okay? Where in the transverse plane is going to be 1.5 to 2 centimeters in width. Okay? And I always revert everything to centimeters because we measure in centimeters on our actual on the actual machine. It doesn't measure in millimeters. Okay? So, and the isthmus is going to be 4 to 6 millimeters thick. Okay? That's 0.4 to 0.6 centimeters. I think that makes me feel like mine was big. I think mine was a little bigger than that when we measured the other day.
A big apple.
Yeah, we'll see. We'll see. So you got make sure you get these numbers right there. Make sure you get these numbers right there. I'm gonna work on like some homework to send you. I'm still working on a crossword puzzle to send you. Sometimes when you put stuff in the crossword puzzle, it doesn't accept all of your questions. You know, because it has to generate. So I'm trying to find a way to make all of my questions fit in there. All right. So here's our anatomic structure again. See the outside right here, guys. This is our fibrous capsule that surrounds the actual thyroid. This is our trachea right here. It has those C-shaped rings around it. Our esophagus is posterior to that. Alrighty. Here's our thyroid cartilage right here, kind of our prominent thyroid cartilage, right superior to the actual thyroid. And you guys have this image in the book.
You know how last time when you were measuring each lobe, it's normal for one to be bigger than another, right?
Absolutely. I said that the right lobe is usually bigger than the left lobe, and in my scanning experience, I don't know if it says that in the book, but in my scanning experience, the right lobe is usually bigger than the left lobe. And you guys let me know when you guys are out there scanning. Let me know. But in my time that I've been scanning, that's what I've observed. That's what I've observed.
When you have that lobe on the isthmus, do you measure with the isthmus or?
No, you don't have to measure it because it's not pathology. So if you just have to image it, and a lot of times it's so thin, it's so small that you won't be able to see it that well.
Just label it.
My Miss Patel.
I wouldn't even label it. It's a normal variant. It's kind of like if I see a Phrygian cap, I'm not gonna put Phrygian cap on there. If I see a double collecting system in the kidney, I'm not gonna put double collecting system. They're gonna be able to see that and
I saw
observe that.
2 Phrygian cap yesterday.
You did? Yeah, that's the most common normal variant you're gonna see. That and those renal variants. Okay. But you guys have this image right here, that anatomy right there. Okay. So let's get back to some anatomic variations again. I told you I was gonna cover this again. Here's the first one we talked about was our thyroglossal duct cyst. Again, that occurs, as a fetus, right? When the thyroglossal tract doesn't solidify in atrophy, it can develop into a cyst right there. That cyst can be 1 to 3 centimeters in size. And again, like I said, it's the most congenital cyst found in the neck. I don't know why that's not in blue.
For the baby, right?
Mm-hmm. It's the most congenital cyst found in the neck. Specifically to the neck, guys. Specifically to the neck.
With the adult, you're gonna have the same cyst or not?
No, this is as a fetus.
Okay.
As a fetus. As a fetus. So when you get those good MFM technologists, they're probably going to be able to identify a thyroglossal duct cyst.
So what are you gonna do about that?
I wouldn't know as a fetus. I don't think they would do anything like while it's still in the mom, while it's still in utero. They would probably have to handle that when the baby's born.
Oh.
Yeah, I wouldn't think they would be able to. I don't honestly. I can't say. I don't know what they would do, but I don't think they would do anything while it's still in utero.
Cause I just wonder, like, they're gonna be like grow up normal with that cyst,
Oh, you can, I'm sure. If you have functioning thyroid, then definitely. Definitely. Okay. And again, our next anatomic variant or anatomic variation is going to be a pyramidal load, which is here's our pyramidal load right here, coming off the isthmus, extending upward in front of the thyroid cartilage.
Pyramidal.
Looks like a little finger-like projection.
50%.
50% of patients you'll find have a pyramidal load. Honestly, I don't see it that often, but you know, that's what the book said. We're gonna go with those numbers. Okay? And then another anatomic variation would be a total absence of the isthmus. Okay? A total absence of the isthmus. Never seen that either, but Miss Patel, she almost don't have an isthmus, right? It's really, really, really thin. Really, really thin. But I never seen where it's totally absent, but these are all just normal variants. Oh, also, pyramidal lobe also can be called an accessory thyroid tissue. Kind of like, have you guys talked about the spleen, right? It's gonna have that accessory lobe, that little round lobe that hangs off the spleen as well, right? Y'all probably seen those. That's a normal variant you see all the time as well. Y'all haven't seen an accessory lobe with the spleen? Okay. But anything that's extra, accessory thyroid tissue, accessory lobe of the spleen. Okay. Also known as pyramidal lobe. So, also, some other anatomic variations would be heterotropic locations. You know, as that thyroid is being formed from the permanent pharynx, as it's traveling inferior, you know, that tissue is going to be implanted along that way. I remember I always say, always check inferior to the actual sternum when you're, or clavicle, when you're looking at the thyroid, because sometimes there can be a mass hanging off the inferior lobe of those right and left thyroid lobes. Okay, but some common heterotropic locations would be, of course, look, this is traveling straight down. Like, remember, it starts at the tongue, right? The primitive pharynx is at the same place as the location of the tongue. So you have like a lingual area where you can have thyroid cartilage. Again, you're not going to be able to see these, right? You know, especially something like that high, because ultrasound, we can't image through the mandible, it's the bone, we can't image through that. So you're not going to be able to see if it's lingual or not, and possibly you probably won't be able to tell because it's only going to be 1 or 3 centimeters. You're probably not going to know what that tissue is. How they probably know, oh, that's thyroid tissue is by doing a biopsy. I'm sure. They probably just can't go in. We can't go in there and eyeball and say, oh, that's some extra thyroid tissue right there. Okay. They're probably just going to know that just from doing a biopsy. So some common areas would be lingual, sublingual, prelaryngeal, and that's the normal thyroid position, and substernal. Again, like I said, always check that area inferior to the sternum. Okay, I'm sorry, posterior to the sternum. Posterior to the sternum. So, and that's the most common congenital. Never mind that right there, guys. I don't know why I put that right there.
So it's not most.
No, the most common congenital cyst is the thyroglossal duct cyst.
Right.
My fault, guys. I think I copied this slide and retyped over that. So, definitely, don't worry about that. Alrighty. So, also, athyrosis, or absence of the thyroid, which is associated with cretinism. And cretinism is just congenital hypothyroidism or underactivity of the thyroid gland at birth. Right? Because if you don't have a thyroid, then you're not going to be able to produce the hormones that are needed to secrete into the body. Okay? And we said that the thyroid controls your metabolism. It also controls the growth retardation, and the development delay in other abnormal features. If you look up cretinism, it's if you Google it, it's a real ugly picture of somebody that comes up. So, underdeveloped thyroid can cause major problems later in life. It causes problems if you develop it in a lifetime. If you happen to have hypothyroidism, then it can cause problems as far as like slowing down your metabolism too much and cause you to be sluggish and have lethargy, and not be at full capacity.
You know, they pregnant women with hypothyroid, they make sure you're taking your medicine. Speaking of that, what you just said.
Cretinism, definitely, and that's the definition of it right there, guys. All right, so let's talk about some relational anatomy. So we're going to talk about anatomy of the thyroid and its relationship to the structures around it, because that's the thing about ultrasound, guys. You have to know all of the structures around the anatomy, because the doctor, you may be scanning the thyroid, and the doctor may be like, what's that? Way over there in the top right corner. And if you don't know what it is, he's going to send you back in there to take another look and tell him what it is. Okay? So you have to know all of the structures that surround the main anatomy that you're looking at. Okay? So I broke this down to anterior, posterior, and lateral and medial. Alright? So anteriorly, guys, you have the strap muscles. The strap muscles are 3 muscles that lay anterior to the thyroid. Okay? Those 3 muscles are going to be the sternocleidomastoid, which is the most lateral of those 3 muscles. Okay? You have the sternothyroid, which is the one that is closest to the actual thyroid. It lies just anterior to the thyroid. And then you have the omohyoid. Okay? Which is
In the middle.
I'm sorry, I said that wrong, guys. The sternocleidomastoid, just think about it, says sternum. The sternum is medial. It's the most medial of those muscles. I apologize. Sternocleidomastoid is the most medial of those muscles.